Welcome everyone, thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 70 new cases of COVID-19 in Windsor and Essex County. 25 are close contacts of confirmed cases, 13 are community acquired, 2 cases are related to outbreaks, and 30 cases are still being investigated. We have had 16,219 cases since the beginning of the pandemic. 358 people are active at this time, with 158 of our active cases being a variant of concern. To date, 1,454 preliminary or confirmed variants have been identified in Windsor-Essex County, with 93% being the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 20 people are currently in the hospital and 1 person is in ICU. I'm sad to report an additional loss in our community due to COVID-19. A woman in her 70s from the community passed away yesterday. Our community has lost 422 people to COVID. There are currently 10 active outbreaks in Windsor and Essex County, 9 workplaces, and 1 community outbreak. Regarding our vaccine rollout, 225,513 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 209,440 people have received at least 1 dose. Overall, 61.5% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. People 18 years of age and older are now able to book their vaccine appointment at one of our mass vaccination sites. Please book your appointment at wevax.ca or through the call center at 226-773-2200. With so much of the focus on vaccinations, we want to remind you that if you have any symptoms of COVID-19, please get tested. Symptoms include fever and/or chills, a cough or barking cough, shortness of breath, decrease or loss of smell or taste, sore throat, difficulty swallowing, pink eye, runny or stuffy nose or a congested nose, a headache that's unusual or long-lasting, digestive issues like nausea, vomiting, or abdominal pain, muscle aches that are unusual or long-lasting, extreme fatigue that's unusual, falling down often. Testing is available by appointment at Windsor Regional Hospital Olette Campus, Windsor Regional Hospital Met Campus, Erie Shores Healthcare in Leamington, Medical Laboratories of Windsor on Malden Road in LaSalle. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Testing is also available for people without symptoms at a participating pharmacy. Please visit our website at wechu.org for more information about COVID-19 and testing and vaccinations. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I don't have much to say other than just reiterating some of the message that Teresa just mentioned about the importance of following the public health measures and ensuring that if you have any symptoms, you're going and getting yourself tested. The key part is the moment you get tested, it doesn't give you a license to go out and break all these rules. It takes some time to build the immunity, and in addition to that, still you have to follow the public health precautions as we have said it many times before. Despite the success of these vaccines and the effectiveness of these vaccines, it's absolutely important that while we still have a high transmission in the community, we have to follow all these public health measures. And unless we do it, we'll continue to see these cases increase and it will continue to delay us for going back to normal. So please, I want to request everyone, first of all, to get your vaccine as quickly as possible. And then secondly, for those who are getting the vaccine, please follow the public health measures until these measures are lifted. And that's the only way we can beat it. We'll then move on to take any questions.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning. This is the biggest daily case increase we've seen in some time. Is there any kind of known lag in the testing data? And I know that a large number of these cases are still under investigation, but if there is no data lag, can you say anything about what might be behind this daily uptick in cases?
Yeah, we don't have any evidence of any delay in reporting. So some of these things that we are seeing, it could be a result of a gathering or an event that we are still have to investigate. We have also noticed that there are some information gaps that we are coming that we are struggling to find. Maybe people are not sharing all the information or everything that they have done. So that's why it's important that people recognize that not only you need the vaccine, but also even after the vaccine, you have to follow these public health precautions. And despite all of that, for those who are either who haven't received the vaccine and are still gathering, I think those are the things that shouldn't happen at all until we have a community transmission that's low and the public health measures are lifted. So I anticipate that some of these could be linked to one or two specific gathering, but again, we're still investigating, and until we complete our investigation, we can't say for sure. And the other gap would be the information gap. If people are not sharing all the information, we may have some challenges in identifying the source and causes of those infection or those transmission.
Thank you. And I understand the health unit isn't running the clinics that are being led by primary care providers in our region, but are you hearing about any challenges, any requests for support in that rollout?
Not really, and maybe I'll pass it on to Teresa to comment more. But generally speaking, when we are working with these clinics, they are to manage all their operation and the logistics. But I'll pass it on to Teresa to comment.
So the primary care providers are, we allocate the vaccine and we support them with the COVAX training, because that is where the immunizations are entered into the provincial system. But, and we do provide support. So I guess I would need to know specifically what you're referring to, but we don't oversee the clinic. They are managing it themselves as they would their own office, and providing vaccines is something within their normal scope of practice. So, the key pieces are the COVAX system, adhering to the current guidelines for distribution of the vaccine, administration of the vaccine, and making sure that the temperatures of the vaccine are maintained according to the manufacturing requirements. And all of our primary care providers receive annual fridge inspections from our health unit staff. So that occurred during the pandemic to make sure they were ready for vaccines coming to their offices.
Thank you.
Any questions from Blackburn?
Yes, just can you speak to the response you had on the website yesterday after launching the eligibility for 18 plus? Were you happy with the response? How did everything respond within the system? How did the launch go?
I can start. There was a very good response. At one point, we were told that 2,600 incoming bookings were being received, at one of the minutes that they did a look at. But yesterday after the announcement, and I have to give credit to our media partners who are doing a great job, because people are hearing the message and going to our sites and booking.
Thank you.
Any questions from the Windsor Star?
Yes. Are you able to say, or do you know whether or not the individual who passed away was vaccinated?
I don't have that information.
Okay, that's all for now. Thank you.
Any questions from AM 800?
Dr. Ahmed, in regards to today's case count, 70, obviously 54 case jump from yesterday when we had 16. When you see the case jump, and obviously, like you said, there's still investigations going on. Who knows, there could have been gatherings, but is it almost like a punch in the gut? Like yesterday was such a positive day, and then today it seems like we got notched down a couple levels here.
Yeah, no, absolutely, and I think that's why the messaging is important, and I've been saying that vocally that I'm optimistic about the future. I'm optimistic about our summer here, but we can only get there when we get a good control. Right now, we're almost close to the finish line. And I keep saying that we're almost close to the finish line, but we're not there yet. And as much as every one of us, including myself, we want to enjoy the summer, we want to enjoy the human connection that we used to enjoy, but it's almost there. We have to get the vaccination rate up to a certain level. We have to have the transmission in the community go down before we can enjoy all of those things. So I think it's critical that if we miss the boat on that one, we can continue to struggle with these cases, and then we'll continue to have to go back and forth with what we are doing and what we are not doing. And it'll be difficult. It'll be a difficult decision to open up when you have 60, 70 cases coming up every day. So it is all our responsibility, and I said that in the past as well, that we have to work together. We have to get this under control. We have to get the vaccine. We have to follow the public health measures to keep the case rates low before we can open up. And the longer we stay with these high case counts, the longer it will take us to get back to our normal.
I was going to ask you this question either tomorrow or Friday with the holiday weekend approaching, but since the jump in cases, I guess the weather is beautiful outside, it's a holiday weekend, I guess your message to the community this coming long weekend.
Well, it's a tough one, and as I said, it's the general messaging is always to stick to your household contacts, and with the warmer weather and beautiful temperatures outside, spend time outside, but closer to your home, not with anyone else, and definitely not any gathering of any sort. So try and enjoy the temperature, the long weekend in a safe manner, and that's critical, because if we don't do it, we will struggle with the case rates. We will struggle with even our vaccine effectiveness. We know that yes, it's so far based on the data we have, it's pretty effective, but we don't know if the effect only protects the individual, or are they still able to transmit or be a carrier of some sort to transmit the virus to someone else? Because that's something that we don't have a really good scientific understanding at this time. So please don't use don't consider yourself immune and protected just by getting the vaccine. You still have to follow some of these public health measures, and it's important that all of us do that to keep ourselves safe and keep our community safe.
And one final one in regards to, you mentioned gatherings. Obviously, there's still investigations going on, 30 today for those cases. You mentioned maybe potential gatherings helped out with the jump in cases. I know Mother's Day was a couple weeks back. Any concerns that those could have been Mother's Day gatherings?
Yeah, you're probably saying it right, and Teresa and I, we were talking about it yesterday too. It's probably about that time, because it makes sense from the 14 days timeline in terms of the spread, and in terms of looking at what happened. So anything that we do, we'll see an impact at least a week or two after the event. So it could very well be from that timeline. But again, as I said, not everything is lost. We can still bring it back, and we all need to be working together. And even a small group of people, if they continue to spread the disease and continue to have these ongoing transmission, it will be difficult for our community. As much as people think there's just one person or just a single event, it can be devastating for all of us for the ongoing transmission. With the almost 30% community transmission, we can get to a bad state. So please, it's really important. We got it under control. Please help us get it under control as well, and make sure that we are able to have a good summer ahead of us.
Thank you.
Any questions from CTV?
Yes, good morning. The province says the reopening framework will look different after the stay-at-home order. Do you have any indication of what it will look like or what you're hoping for?
I don't. I think it's some of the discussion that and I think I even mentioned that yesterday in the broadcast that I am aware that there's been some ongoing dialogue with respect to some of these changes, the thresholds, what is allowed and what is not allowed. I think those are the discussion that they're having, and I don't have any more insight other than that.
Okay, and do you anticipate many people from Windsor-Essex going stateside to get vaccinated? And do you have any concerns with it, with the lack of, with them not quarantining on return?
Well, at this time, I am waiting for the federal government to clarify the position, because clearly this is a shift in what we have been hearing from the federal government. So I am looking for some official confirmation. I know that this has been communicated via email, but we want to make sure that at least the high-ups in the federal government have a clear understanding of what their position are, and then we'll have to make a decision locally, because throughout this pandemic we talked about how traveling, how people interacting with others could lead to potential transmission, and recognizing that maybe even 70, 80, or even 90% of the people would go there for the right reason. But even for those 10% or more people, if they're going in for the wrong reason, and if they're bringing back some of these variants, because we know in Michigan also they're having some challenges with the variants of concerns. They're also their vaccination rate is at this time, especially in Detroit, is lower than what we have here. So it's absolutely important that we take all of these matters into consideration before we jump on board to get the second doses and drive to Michigan to get it. The ideal solution that we've been talking about and we've been working on the background is, how do we get the vaccine here, recognizing that there are challenges. It's not easy, but that's the ideal approach, that if we can get the vaccine, and if we can use the vaccine locally rather than sending people there, that would be the ideal solution. But we'll have to wait and see until we hear the final words from the federal government.
Okay, and one final one. What are people supposed to do if they didn't get a notice or confirmation that they got a vaccination when they went to one of the spots within Windsor-Essex? We're just hearing some people didn't get confirmation. Now they're wondering what to do.
So I think this happened last week or the week before as well. So people who got their vaccine at the on the pop-up site, they received a confirmation a few days after because of the delay in entering all that information into COVAX, but they did receive the confirmation after a few days.
Great, thank you.
Any questions from CFTV?
Yes, good morning. Do you have any plans to vaccinate our migrant worker agricultural sector, specifically offshore migrant workers?
So we have already done our vaccination of temporary foreign workers and people that are working on the farms in Essex County. And that started on April 18th, and we did probably I would say went into almost 2 weeks and vaccinated 4,779 people through that initiative. And we continue to offer opportunities for vaccination in our Leamington Nature Fresh complex, where people continue to get vaccinated. And we are working with the farms, and we do have that ongoing conversation about anyone that needs vaccination and making sure that they have the opportunity to receive it. So we we did do a very good job in vaccinating our farm workers.
Did you find that the migrant workers came out readily and willingly to have it done?
So we worked individually. Our staff and partners worked with the farm operators and owners and the farm the workers themselves to make sure they had the right information. But overall, we think that those that wanted the vaccine were given that opportunity, and they did. It's a very good response. We are told that there are probably 8,000 workers in our area, and looking at that, we've done about 5,000. That's pretty good.
And one more question, if anyone wants a vaccine from there, are they able to just contact you, or do they have to go through their employer?
Well, they have the ability to book a vaccine appointment at the clinic in Leamington, and also we are looking at doing some reaching out some more to give them more opportunity for anyone that's wanting to have a vaccine. And we do work with the farm operators, though, and make sure that anyone new coming onto their farm, or anyone that wants a vaccination, that they are aware of how to receive a vaccine. We also have, through our Chamber of Commerce, the ability to use transportation for workers that need to get to the vaccine site. So there's the opportunity. We're also working with the Mexican consulate and other partners regarding temporary foreign workers to make sure that the communications are out there and that people know how to access a vaccine and where to get good information from.
Thank you very much.
Any additional questions from CBC?
Yes, one of my colleagues reported on a situation where a man who got a vaccine at a primary care clinic, he said he was initially issued a vaccine record indicating he got a different vaccine than the one he was told he received. I'm wondering if you have any comment on that specific situation and what someone should do if they have concerns about those kinds of issues.
So I think it's a tough one. We'll have to investigate and figure out what the exact cause for this discrepancy was, and we typically know which vaccines are given to which primary care provider on which day. So we do track that information, and if there is any data entry issue, obviously that can be fixed. But we'll have to investigate specifically before we can make a comment. If people have any concerns, I think their best point of contact is the healthcare provider who has provided them with the vaccine, because they are in the best position to know exactly their circumstances, and they can provide the answers. But from our perspective, obviously, we want the accuracy of the information and data quality. So we'll have to take a look at that before we can comment further.
Thank you very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, Doctor, you previously shared data from Public Health Ontario that shows how effective the vaccines are, even one dose after 14 days. But you also say that vaccinated people still need to be cautious. So what information are we still missing about vaccines that means vaccinated individuals have to keep their guards up?
So what we know for sure, and that's what the data so far has shown, that if you are vaccinated, you will not develop the severe disease. The likelihood of you going to hospitalization or hospital care would be minimum to low. Like almost 100% of all these vaccines have shown that all these vaccines are good in preventing hospitalization and severe disease after getting the vaccine. What we don't know is, yes, I am protected after getting the first dose of the vaccine, but can I still carry the virus on my body and maybe in my nose and mouth? And then if I am with other people, even though I am safe, my body will not react to it. But because others around me are still unprotected, is there any ability for these viruses, because they are on me, can they go on to infect other people? we don't know that much information at this time. So we have to learn more from the real world data to understand it better. So that's why it's important that even though if you are vaccinated, you still have to follow all these precautions, because technically you can still be a carrier and then you can pass it on to others who could be at a higher risk of developing the disease, or maybe not vaccinated, or maybe partially vaccinated. So I think that's where it's important that we, as long as the virus is still circulating in the community, we are at a risk. We are at the probability of me coming in contact despite having the vaccine with the virus is high. If the community transmission goes down, the likelihood or probability of me coming in contact into any of the virus would be low. So that's why if we as a community overall, if we're thinking about getting the vaccine and doing our part until we get the case rates down, we will be in a better shape. When the case rates are down, the virus will not have a viable host to continue to move on to infect other people. When you have so many viruses and so many people that are still infected and they're still doing the transmission, the overall risk to the community would increase.
Thank you for the explanation.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Thank you, everyone. Have a great day.